Aspartame has been a popular artificial sweetener since its introduction in 1981, promising a sweeter alternative without the calories of sugar. Initially celebrated for its potential to combat rising obesity and diabetes rates, aspartame's journey has been marred by controversy. Concerns regarding its safety have sparked numerous studies, leading to conflicting findings about its health implications. Research has explored the effects of aspartame on various health conditions, including obesity, diabetes, neurological disorders, and even cancer. While some studies suggest potential risks, others advocate for its safety within regulated limits. This ongoing debate highlights a critical need for continued research and transparent labeling, ensuring consumers are informed about products containing aspartame. As public interest grows, the conversation around its safety remains essential in guiding dietary choices and health recommendations. Aspartame was invented in 1965 by James M. Schlatter. Schlatter obtained this compound as part of research into anti-ulcer drugs. He discovered the sweetness completely by accident after licking it off his finger, against work safety regulations. After initial obstacles to the legalization of this compound as a food additive, its large-scale production began in 1981. The attractiveness of aspartame as a sweetener is since it is about 200 times sweeter than sugar, while its calorific value, at the concentrations giving the impression of sweetness, is almost zero. However, the taste of aspartame is not identical to that of regular sugar. The flavor takes longer to appear and typically has an aftertaste. Is 40 mg per kg body weight in Europe and 50 mg per kg body weight in the United States for both adults. As many products contain aspartame, both children and adults can unintentionally consume larger amounts than those recommended by the FDA, which may lead to serious health complications. Food with aspartame must be labeled with the information contains phenylalanine. In addition, the labeling of foods containing aspartame must indicate that they are not recommended for cooking and baking. Although many studies have been performed to determine the health effects of aspartame, the results of its long-term use remain difficult to predict, and its use in pharmaceutical and food products remains controversial. 2. Aspartame metabolism. Aspartame consists of two amino acids, L-phenylalanine and L-aspartic acid. It is hydrolyzed and absorbed in the gastrointestinal tract, GI, through the action of esterase and peptidases. Which are absorbable in the intestinal mucosa. These metabolites can be harmful at high doses, and hence prolonged aspartame consumption may be a risk factor. Indeed, the metabolism products of aspartame are believed to be more toxic than the original substance itself. Methanol is firstly oxidized in the liver to formaldehyde and again to formic acid. However, while methanol is known to damage the liver, formaldehyde and formate are also responsible for the destruction of liver cells. In addition, during the process, the formation of superoxide anions and hydrogen peroxide occur, which lead to protein denaturation and subsequent enzymatic changes. According to the study on the impact of aspartame administration on transsulfuration pathway, decrease of most metabolites of the transsulfuration pathway in the liver was observed during experiment. Levels of cysteine, homocysteine, S-adenosyl homocysteine, and S-adenosyl methionine were increased. There was no significant change in methionine and cystathionine level. All mentioned aspartame metabolites are toxic to the brain. Furthermore, phenylalanine is mainly metabolized to tyrosine in smaller amounts of phenylethylamine and phenylpyruvate, while aspartic acid is metabolized into alanine and oxaloacetate. It has been suggested that in human beings consuming large amounts, aspartame may be a significant source of format, which can contribute to serious physiological changes. The role of aspartame in several disorders affecting human body remains to be investigated. Most importantly, people with phenylketonuria, a genetic disorder in which patients cannot convert phenylalanine to tyrosine, must avoid aspartame due to the harmful effects of aspartame on phenylketonuria patients. According to the FDA requirements, all products containing aspartame must have a label informing about the presence of phenylalanine.